Time's now 7:14. Oftentimes we hear about keeping an eye on our cholesterol levels, but do we really, or what do we really know about cholesterol's distant cousin, triglycerides? Well, here to explain what triglycerides are and why recent studies are showing how we treat it matters is Dr. Lutz of the New Orleans Medical Society.
Good morning.
It's good to see you.
Thank you.
So let's first explain to people what triglycerides are.
Well, Kelsey, triglycerides are fat molecules that circulate in the blood and are commonly measured the same time people measure cholesterol.
And what is the connection between cholesterol and triglycerides?
Well, they're both lipids. They're both in the what's called lipid family. However, cholesterol has a direct link to certain diseases, and lowering cholesterol decreases the likelihood of what cardiologists and physicians call events. You don't want an events like a heart attack, a stroke, or something like that. And statins do a very good job of lowering that. Now, there are also drugs to lower triglycerides. A normal triglyceride is said to be 150. A lot of people have slightly elevated triglycerides. However, lowering the triglyceride with drugs that are out there, like fenfibrate, do not improve any outcome. So you're decreasing a number, but you're not doing yourself any good. And this has become more and more apparent recently. And maybe it's related to the statins being so good on decreasing the risk with cholesterol.
And I know people often get their cholesterol levels checked, and that's something that doctors address immediately with medication or telling them to alter lifestyle or make lifestyle alterations. But at what point are elevated triglycerides an issue, and how do you go about starting the treatment regimen for that?
Well, elevated triglycerides can be a marker that you are more prone, say, to diabetes or heart disease. But again, lowering them doesn't decrease that risk. Lowering cholesterol does, but lowering triglycerides doesn't. When triglycerides become a problem is when they get over 500. I know there's certain medications that can cause triglycerides to soar. I watch my HIV positive patients closely with their triglycerides, because if they get over 500, you can develop some pancreatitis and pancreas problems. But the cardiovascular risk factors seem to be all tied to cholesterol, not triglycerides. We'd probably be just as well off in most folks if you never even measured them.
That's an interesting thought then, Dr. Lutz, but something to consider.
Watch that cholesterol. The cholesterol is something you can lower and make a difference. You can lower the triglyceride with some medications, but you're more likely to have side effects than positive outcomes.
All right, Dr. Lutz, hopefully that clarified some things for people and put some things in perspective for others.
Thank you, Kelsey.
All right.